Everyone, in the previous video we had already studied about the sole of the foot. Okay, I'll show you what all we studied the sole of the foot, the skin, the fascia, that is the superficial fascia, the deep fascia, the contents, the superficial fascia in detail, the cutaneous nerve supply in detail, and then we studied the plantar aponeurosis functions, attachment features, and we studied the deep transverse metatarsal ligament, and then we also saw the fibrous flexor sheath, and this is where we ended our last video. And today we are going to study the vessels, okay, the plantar vessels and the plantar nerves, okay, the chief artery of the sole. My brother was making me laugh. But anyways, we are going to study the plantar vessels and the plantar nerves. Okay, we are going to see the plantar vessels and the plantar nerves. The chief arteries of the sole are the medial and the lateral plantar arteries. Okay, as we see, this is the we are studying the plantar vessels. So the plantar, we have two sides, the medial side and the lateral side. So of course it is very much obvious that there are two arteries, that's the medial and lateral plantar arteries, which are the branches of the posterior tibial artery. Okay, these are the branches of the posterior tibial artery. Which one? The medial and the lateral plantar artery. They are the branches of the posterior tibial artery, not the anterior tibial artery. Keep that in mind. Now, the chief nerves of the sole of the foot are the medial and lateral plantar nerves. The chief arteries are the medial and lateral plantar artery, and the chief nerves are the medial and the lateral plantar nerves, the branches of the tibial nerve. Okay, so these are the branches of the posterior tibial artery, and these are the branches of the tibial nerve. Okay, so these artery and veins begin deep in the flexor retinaculum. Okay, we had already studied the flexor retinaculum. We have two retinaculums, that is the superior, wait, let me change to the pencil. Yeah, we have superior flexor retinaculum and the inferior flexor retinaculum. The superior is in the rectangular shape, and the inferior, it is in the Y shaped. Okay, it is in the Y shape. Please do check out the video if you haven't seen it. I'll link it down in the description below. Now, the arteries are closer to the margins of the foot. The arteries are closer to the margin of the foot. Okay, they are closer to the margin of the foot, corresponding to the nerves. Okay, they are near to the margin of the foot as compared to the nerves. So the lateral nerves and the vessels, it runs obliquely towards the base of the fifth metatarsal bone between the first and second layers of the foot. So the foot has four the foot has four layers. Okay, it has four layers, and it contains muscles. Okay, so we will study those muscles in next video, that we have already told that we'll study the muscles in next video. So see, the nerves and the vessels, they run obliquely towards the base of the fifth metatarsal bone, that is the little toe. Okay, the little toe, between the first and the second layers of the foot. The medial plantar nerve and vessels lie between abductor hallucis and the flexor digitorum brevis muscles. So these are the muscles that are lying in between the first and second. Okay, as we have already told, the layers of the foot, there are four layers, so these are in between the layers. So the medial plantar nerve and the vessels, they lie between the abductor hallucis and the flexor digitorum brevis. Now the medial plantar nerve. Okay, we are going to see the medial plantar nerve. It is the larger terminal branch of the tibial nerve. Suppose this is the tibial nerve. Suppose I take this as the tibial nerve. It has two terminal branches. A larger one and a smaller one. The larger one is the medial, and the smaller one is the lateral. Okay, LS and ML. Okay, remember ml. Okay, ml of milk, ml of water. So medial side is the larger terminal branch and lateral side is the smaller terminal branch. Okay, now let us see the beginning, course, termination and its branches. So the terminal branch of the tibial nerve, it begins as the terminal branch of the tibial nerve, begins deep to the flexor retinaculum, as I've already told, and the flexor retinaculum, it is already completed in the previous video. Please check it out. And course, it passes deep to the abductor hallucis. I told abductor, but I've written adductor here. So this is not adductor, it is the abductor hallucis longus. Okay, so this is the abductor hallucis, okay, as we have already seen that. So it passes deep to the abductor hallucis, runs between the abductor hallucis and the flexor digitorum brevis, as we have already seen, accompanied by the medial plantar artery. Okay, we saw that it is accompanied with the vessels as well. So the vessel, it is the medial plantar artery. Now what are the branches? The branches are, it gives off muscular branches, okay, to the abductor hallucis, flexor digitorum brevis, and the flexor hallucis brevis. First lumbaricals, that's on the medial side of the sole, medial 1/3 of the toes. Okay, the medial 1/3 of the toes, these are the branches. And the clinical integration is that the medial plantar nerve entrapment, it is also called as the jogger's foot. If the medial plantar nerve entrapment is nothing but it is trapped, okay, it is trapped, or if it is compressed, it leads to the, it is called as a jogger's foot. So this is about the medial terminal, medial plantar nerve. And now let us see the branches. As I've already told, the muscular branches are the abductor hallucis, flexor digitorum brevis, and flexor hallucis brevis. This is at the first digital this is the first digital supplied by the first digital nerve, and the lumbrical muscle by the second digital nerve. Okay, now we have the calcaneous branches, okay, the cutaneous branches, 4 digits, okay, 4 digital nerves. So supplies the skin of the medial side and the 3/2 of the toes. Each digital nerve gives off a dorsal branch that supplies the respective toenail. Okay, suppose there are 4 nerves, so each nerve gives off a dorsal branch to supply the nail of that respective toe. Okay, so this is the cutaneous branches of the medial plantar nerve. And the articulating branches, it supplies the joint of the tarsal and the metatarsal. Okay, joint of the tarsal and the metatarsal. So let us see in the diagram. 4 muscles supplied by the medial plantar nerve, that is the abductor hallucis, the flexor digitorum brevis, and the flexor hallucis brevis, the first lumbarical, and the digital nerve. And at the tarsal and the metatarsal, it supplies as the articulating branches. And the cutaneous branches, it gives off to the dorsal terminal branches of those supply to the toes. Okay, this is what we saw. Now what are the lateral plantar nerves? Okay, what is the lateral plantar nerve? It is the plantar nerve that is on the lateral side. It is a smaller terminal branch of the tibial nerve, as I've already told. Suppose this is the tibial nerve. It gives off 2 branches, a smaller one and the larger one. Remember ML in this case. M stands for the medial and L stands for the larger. So it's ML. So of course the lateral side, it is the smaller. Okay, the smaller terminal branch of the tibial nerve. Its root value is S2 and S2 and S3. How do you remember it? S23. Samsung S23. Okay, S23. So just remember this. Which one? The lateral plantar nerve. So root value is S1 and S2. Okay, so but in the textbook it was given as S23. We will see that at the last. So let us keep it there. Now the beginning is terminal branch of the tibial nerve begins deep to the flexor retinaculum, same as that one, the previous one, that is the medial. Begins deep to the abductor hallucis, runs between the flexor digitorum brevis and the flexor digitorum. Okay, further between the first and the second layer of the sole, same. Okay, now the branches are the main trunk, the flexor digitorum accessorius, and the abductor digiti minimi. Superficial branch goes to the flexor digiti minimi brevis, and third plantar and the fourth dorsal interossei. This we will study in the muscles. Okay, in the muscles. Deep branches to the second, third, and fourth lumbaricals, first and second plantar interossei, and first, second, third dorsal interossei. Okay, so these are the branches of the lateral plantar nerve. So see, this is the flexor digitorum accessorius, and this is the abductor digiti minimi. This is the superficial branch. Okay, the superficial branch, interossei of the fourth space, extensor, flexor digiti minimi brevis. This is a plantar digital nerve, fourth space, lumbaricals, and the abductor hallucis, and it also has the deep branch. Okay, the deep branch. So we are done with the nerves. Now we are going to see the arteries. Okay, the medial plantar artery and the lateral plantar artery. It is a smaller branch. Okay, so see here it is completely opposite. There we saw ML, right? There we saw ML. Wait a minute. Yeah, there we saw ML. M for medial, L for the larger. Okay, but here the medial one is the smaller. Okay, so there you remember milliliter, here you remember meter per second. Okay, so that's how you remember it. So this is the latter one. It is the large branch of the posterior tibial artery. So see, these are the branches, and we have a most important topic here. This is the plantar arc. Okay, we have the plantar arc. Okay, so this is the flexor retinaculum. This is the medial plantar artery. It is a connection with the dorsalis pedis artery that is on the dorsum of the foot. We have already seen. Please go check that out. This one, whatever you see, is a proper plantar digital artery. Then we have this one. This is the plantar metatarsal artery. This is the dorsal perforating branch. So this is the dorsalis pedis artery. Okay, whatever you see here is the dorsalis pedis artery, and this is the posterior tibial artery. See, this is the posterior tibial artery. सारे branches उसी के हैं, ठीक है? These are the branches of it. So branches of the medial plantar artery is branches of the surrounding. It supplies the branches. The branches supply to the surrounding skin and the adjoining muscle. Three small superficial digital branches. They joining first, second, and third plantar metatarsals. Okay, and this supplies the lateral sole of the muscle, skin of the fascia of the lateral side. Lateral side, of course, it supplies on the lateral side, and the medial one supplies on the medial side. And the branches of this side anastomose with the arteries of the dorsum of foot. We have already seen this in the dorsum of the foot chapter. Please go check it out. So anastomosis is formed between the dorsum of the foot arteries and the sole of the foot arteries. Okay, now the last topic of this chapter is the plantar arc. Plantar arc is the arterial arc located between the third and the fourth layer of the sole of the foot. So now we saw the nerves. They are located between the first and the second layer, but this one is between the third and the fourth layer of the sole of foot. The beginning is, it is a direct continuation of the lateral plantar artery. Okay, it is a direct continuation of the lateral plantar artery. Let's see here. See, direct continuation of the lateral plantar artery. So this one, whatever you see here, this is the plantar arc, and this is the lateral plantar artery. It is the continuation, and that we call it as the beginning of the artery. Now extent, its base of fifth extent is from the base of the fifth metatarsal bone, the proximal part of the first intermetatarsal space. It lies between the third and fourth layer of the skin, as we have already seen. Okay, now the branches of this are 4 plantar metatarsal arteries and 3 proximal perforating arteries. 4 plantar metatarsal arteries. Okay, it gives a 4 plantar metatarsal arteries. Okay, so this one. Okay, this one, and these are the three perforating branches, and this one are the metatarsal arteries, plantar metatarsal arteries. So these are the branches, beginning, course, termination. We are done with the chapter. Thank you so much for watching. In the next video, we will study the muscles of the foot, sole of the foot. Okay, thank you so much.